So we were learning about the amphotericin B, or the drug which is very commonly used as one of the important antifungal drug, including the recent mucormycosis. So already we have learned about the this is the amphotericin B is a amphoteric choline antibiotic, and it is obtained from the Streptomyces nodosus. So it is derived along with the amphotericin A, and not used chemically, clinically in 1956, one of the most oldest drug, and it is insoluble in water and little unstable, and is rapidly decomposed on the exposure to light. The commercially available powder for injection contains the sodium desoxycholate as a stabilizing agent. Then the structure of this amphotericin already we have learned. Then the chemistry is already it is dealt. So amphoteric. So coming to the mechanism of action, it is very similar to the general mechanism of the other antifungal drugs, and it has very high affinity for the sterols, particularly the ergosterol, and present in fungal cells of the membrane. And the interaction with membrane ergosterol, formation of channels or pores with altered membrane permeability. So then what happens is leakage of cellular contents will happen, and the fungus is going to die. And altered potassium hydrogen exchange results in the efflux of potassium and influx of the hydrogen ions, producing the state of the acidosis, especially, which halts some important enzymatic process. So we will see the graphical representation or the videographical representation of the mechanism of action of the general antifungal drugs. So the fungus, it's a cell wall is there. Then you can see that the fungus is having a very specific cell wall, and it is containing the cell membrane. Inside cell membrane is there, and cell membrane, and these are the ergosterols. So the building block of the cell membrane is then there is an enzyme, the beta-1,3 synthase, and it's usually it plays the particular chain, peptide chain, beta-1,3 glucan and beta-1,3 synthase. So the azole antibiotics, especially miconazole and other things, they are going to come in and they are binding with that of the 14-alpha dimethylase, and which is also a combined enzyme with that of the cytochrome P450. So the varieties of the antifungal drugs will have the different mechanisms, and because of this thing, the cell membrane is lysis happens. Whereas the amphotericin B, the present drug, what we are dealing, it's coming inside the cell, and especially the bacteria, this fungal cell, and it hampers the potassium hydrogen ATPase pump. So it opens the potassium hydrogen ATPase pump, and because this thing, the bacterial cell membrane become destabilized, and the varieties of the other drugs are also acting on beta-1,3 synthase, so which is a very important step in the cellular transport of the antifungal drugs. Whereas these agents, so the loss of important organic molecules such as the amino acids and sugars from the fungal cell results in irreversible damage. So you know the brief mechanism. Anyway, we'll go in detail in later in coming slides. And it binds preferentially to the ergosterol rather than the cholesterol. So the principal steroid found in the cholesterol is the principal sterol molecule present in the mammalian membranes, a relative but not absolute, and its specificity is totally it is conferred. And high concentration of amphotericin B directly disrupts the fungal cell membrane permeability. Yes, as we have seen, the potassium and hydrogen pump, it will be hampered, and hence the permeability will change. So amphotericin B, like other selective antifungal agents, so it has also come the immunomodulatory action, especially little immunomodulatory action by potentiating both humoral and cell-mediated immunity. You know what are all the humoral immunity and cell-mediated immunity. And this enhances the host's ability to fight fungal infection. So the amphotericin B is a fungistatic drug in normal dose, but in a very high dose fungicidal, it becomes the fungicidal drug. And coming to the antifungal spectrum or antimicrobial spectrum, the amphotericin B and other choline antibiotics have the broad spectrum antifungal activity. That's the advantage of these agents, because the sensitivity of various species and strains of fungi to these antibiotics vary widely. It differs from one agent to the other agent and useful against several systemic fungi, including the Candida, Histoplasma, Cryptococcus, then Blastomyces, Coccidioides, Aspergillus, and Sporithrax. So there is a big range of the fungal species which are susceptible to the amphotericin B, and it has greater activity against the Candida albicans, the Aspergillus, and coccidial meningitis than the newer azoles, because it has got good penetration capacity. It itself is having some immunostimulant activity. Whereas the dermatophytes are inhibited in vitro, but it is not effective against the clinical dermatophytosis. Maybe in vivo efficacy is not there. Then some algae and protozoa like this Leishmania, then Trypanosoma, then Trichomonas, then Entamoeba histolytica. All these are sensitive to the polyene antibiotics, because it's an antibiotic also. So it is effective against the Leishmaniasis and Trypanosomiasis also, especially in case of different susceptible species of the animals. And amphotericin B has no antibacterial, anti-rickettsial, and antiviral action. So unlike the antibacterial drugs, the correlation between the MIC and clinical purpose of the antifungal drugs is usually poor. So, whereas it is an established factor in other drugs. So the assessment of the antifungal action of amphotericin B is generally done through efficacy studies in the animal models. So that's why the animal models are very much required for the experiment is concerned. Then coming to the resistance pattern, how the resistance is gained. So as usual, it is similar to the other antimicrobial agents. So the number one, it is going to decrease the ergosterol content in the fungal cell membrane. So to gain the resistance inside the fungal cells, so the change itself, the ergosterol content, so that there is no spike for the binding of the antifungal drugs. And cross resistance with nystatin may develop rarely. Then coming to the kinetics in very short. So they are poorly absorbed from the gastrointestinal tract, And therefore, oral antimicrobial therapy or the antifungal therapy is used only for the gastrointestinal fungal infection. So, in the gastrointestinal, many times the fungi are also causing some of the infections, especially in case of SIBO, that is small intestine bowel overgrowth of all the organisms, including the fungi. And for systemic infection, given repeated daily slow IV injections, because it is not absorbed after the IM or other parenteral routes. So it is only administered by IV injections, because in the other routes, the absorption is erratic. So whereas the IV injection distributes unevenly in different type of the distributed unevenly, then throughout the body belonging, highly tissue bound in some organs. So it fails to achieve therapeutic concentration in some of the body fluids, such as the cerebrospinal fluid, vitreous humor, and amniotic fluid. So these are the areas where it cannot reach because of the different barriers. Then it is a distribution in the pancreas, bone, muscles, and CNS is somehow limited because it is not going to pass different barriers. And inflammation for various penetration into the drug, into the various body fluids. Whereas it is not going to pass the blood-brain barrier, hence it is administered intrathecally, means in the thecal space of the spinal cord, it is going to be injected. Whereas extensively it is bound to plasma proteins, especially in case of the humans and also in case of the mammals. So this appears to become associated with cholesterol-containing membranes in many tissues, just like the peptidoglycans in case of the gram-positive bacteria. Here, the cholesterol is having the basic support to the cell wall and its stability. So later, once absorbed, it is exposed to different tissues and then slowly released into the circulation. So the elimination, how it is done, it is little complicated, and in the humans and animals, due to the binding up of the drug to the tissue and cholesterol. So the drug is going to bind with that of the tissue and also to the cholesterol. So this drug, amphotericin B, inhibits the biphasic elimination with an initial plasma half-life of 24 to 48 hours, but which is also followed by the longer terminal half-life, about 15 days. So this has got the biphasic elimination, means immediately after the administration, initial plasma half-life is that's the 24 to 48 hours, but it has also got the longer half-life, especially 15 days. So this biphasic elimination refers to the excretion of the drug with simultaneous disruption in the particular tissue. So the plasma concentration curve, especially plasma concentration time curve, so after Cmax shows the different orders of the release. Then the low levels of the drug, mostly the metabolites, appear in urine over a period, long period, not very shortly, but it takes long time. Drug is eliminated via bile. So instead of excreted in case of the urine, the metabolites of these drugs are eliminated via bile. In human patients, it takes more than 2 months for complete clearance of the amphotericin B. That's one of the alarming thing, because such a long half-life, at the same time, the concentration of the amphotericin, which stays for more than 2 months. And coming to the side effect, whenever there is an effect, you know very well that the side effect will be present. So it is causing the nephrotoxicity. It is by the two mechanisms. Number one, intense renal vasoconstriction. So the blood supply to the kidney is going to be drastically reduced, or the vasoconstriction occurs, and binding up of the drug to membrane cholesterol in the renal tubular cells. So this is also the intelligent way of the microorganism, that it will bind to the membrane cholesterol of the renal tubule, and along with that, it tries to cheat the host cells that it is not a foreign body. And vasoconstriction of the renal tubules occurs within 10 to 15 minutes of the injection, and lasts for 4 to 6 months. Actually, this is the scientific data. And this results in reduced blood supply and decreased glomerular filtration. Or so ultimately what happens? This results in reduced blood supply and decreased glomerular field repair. Then interaction of the drug. With the renal membrane cholesterol produces alteration in the tubular membrane permeability, leading to altered electron fluxes, especially the potassium and hydrogen fluxes. The acidification abnormalities, that is the metabolic acidosis, and concentrating effects like this polyuria and polydipsia. More and more urine will be outward. To compensate this particular water loss, the fluids are given. So the water loss can be observed in case of the small animal, like the polyuria, means repeated time it is going to urinate and it will be hungry. Polydipsia. So just like this lead and other thing, these drugs most bone buffering activity and excess release of the calcium into the circulation. So it is going to go inside the bone marrow, then it is going to replace the calcium which is present inside and causes excess calcium in the blood, which may precipitated in acidic environment. And the kidneys resulting in the nephrocalcinosis, means nephrogenic, these calcium stones are formed. So especially these drugs do not have any biological difficulty, but treating the systemic disease, it's okay. So renal toxicity, it generally depends upon the total cumulative dose and duration of the therapy. And the renal function usually returns to normal after the drug withdrawal, and some residual damage can persist even after the discontinuation of the particular drug. That's also the amphotericin B. When compared to the other animals, all other animals, the cats do apparently more sensitive. So of course, the cats are very sensitive animals. So anything may kill the cats of a owner. And the systemic administration is also associated with other adverse effects like the anorexia, nausea, vomiting, then anemia also because of the bone marrow suppression, then cardiac arrhythmias, especially the CNS signs, if it is given intrathecally. Because whenever the drug you are going to the intrathecal, it will reach the brain. So it may cause arrhythmias and hepatic dysfunction and thrombophlebitis at the site of action. So these are all the general common side effects. And anaphylactic type of the reactions can also happen many times. Okay. Then coming to the treatment of the side effects itself is somehow complicated. But we need to address certain important conditions like number one, pre-treatment with antiemetic like the perinorm or metoclopramide. So many drugs are there. Then antihistamine agents also like chlorpheniramine and the congeners. So this prevents the nausea, vomiting, and the hypersensitivity reactions. This slide is put here to explain how the fungus cell will be. So this is a left side one fungal cell is you can see, and it is containing the very well developed the mitochondria, the nucleus, etc. Coming to the outer coat where we are having some interest is the cell membrane and cell wall. So the cell membrane is located here and all of them combinedly form the cell wall. Whereas the outer layer is the proteins, different type of the proteins here. It may be alanine, glycine, like that only, just like the bacterial cell. Whereas the beta glucan is the middle one, this beta glucan bond. And the chitin structure is there before this particular thing, especially it is separated from the cell membrane, of course, which is having the less susceptible to the cell membrane lysing drugs. So the ceralastatin and dopamine infusion may reduce oliguria and azotemia. And intravenous fluids like this furosemide, you have learned, it is a high ceiling diuretic. So if you administer this thing, furosemide and the amphotericin B, it prevents the fall in renal blood flow and glomerular filtration rate. So it requires a special carrier system. It's also called as the micros. It's also called as the liposomal carrier medium or the system. So it is introduced to deliver more and more drug sensitive to the cells of the action, which is thought to be more important one. So the aminoglycose, this amphotericin B, is also being prepared in various fat emulsions to decrease incidence of nephrotoxicity. But instead of all this effort, lipid emulsions products like the liposomal products are more likely to cause the side effects like the vomiting, nausea, and also the phlebitis, severe pain in the site of the injection site. So it causes the phlebitis. Then coming to the contraindications. Yes, this is also, as this is one of the toxic drugs, one need to use a lot of care, especially using this particular drug. So this drug is contraindicated in patients that are hypersensitivity to it. This sentence holds for almost all the agents in the chemotherapy. So the infection is like, if it is there in infection, which is an emergency situation where life-threatening and no alternative is available, this is taken care by the amphotericin B. And it should be used with extreme caution with renal insufficiency, and patients' renal function should be aggressive, and it is monitored during the therapy. So that's also another instruction to the candidates who use this drug. Then proper prophylactic means before the disease comes, prophylactic medication, as I mentioned above, should be followed to decrease the incidence of adverse effects of these drugs, especially polyene antibiotics. Then there is an important chapter that's a drug interaction. We should know what are all the drugs should not be administered along with the amphotericin B. So this may be combined with antimicrobials like the 5-fluocytosine, then the minocycline, then rifamycin, and it produces the synergistic effect. So this is the synergy with the 5-fluocytosine, etc. Then, however, there is a combination of amphotericin B and miconazole, azole derivatives, has reported to produce the anti-agonistic effect. So this also one should know. And these things not recommended concurrently with digitalis because the amphotericin B induced hypokalemia aggravates the digitalis induced. There is also the cardiotoxic effects. And this should not be used with loop diuretics. Corticosteroids may exacerbate the potassium losing effect. Then the combination of the amphotericin B and the NMBs enhance skeletal muscle reaction, relaxation. And the combination of amphotericin B and the anti-neoplastic drugs produce the enhanced cytotoxicity. So they should not be treated simultaneously. Coming to the clinical use, so you should see that the amphotericin B is a anti-coronaviral antifungal. So it has been very popularly used now. So effective in antifungal agent, and especially the mucormycosis is treated, which is secondary to the coronaviral infections. And it is used mainly in case of dogs and some other species of the animals for the serious life-threatening systemic infections. And effective treatment may require several courses because it is having a lot of toxicity, but we need to treat the patient. And the treatment frequency and duration vary with the type of the infections. So how it is administered? It is administered in 5% dextrose and administered very slow IV. So in the hospitalized patient only, this is administered. Whereas occasionally or rarely, this is used topically for the cutaneous and mucocutaneous candidiasis. Coming to the dose, 0.25 to 0.5, a general dose. So it is available as amphotericin B. That's the injection, which is containing 50 milligrams. So the total dose is here, which is available, 50 milligrams, and it is for the IV infusion only. So directly IV should not be encouraged. And the dose of the particular drug, amphotericin B, it should be reduced to half when used in combination with flucytosine because both of them are acting in the synergistic pattern. Then this is the amphotericin B mechanism. Yeah, please work. Yeah. Yes, this is one of the important disease now ongoing, especially in the situation of corona. So students, please give some this attention, especially the mucormycosis, which is also called as the black fungus. This is the what you call as the talk of the town. Everybody is knowing about this mucormycosis, and you will see how it is going to act. Okay. Is it audible? I think Meghana, you are told that nothing is audible. Hello?
Sir, in that video, sir.
No, it is not audible.
No, sir.
Video
That
audio.
video.
Okay. Then I will skip it. There's no problem. So the nystatin is the next antimicrobial agent, and it is also a foliin antifungal antibiotic produced by the streptomyces. That's the NORCEL. And it is all the mechanism, structure, activity, relations, etc. are very similar to that of the amphotericin B. And it has activity against the variety of the fungi, but its use is restricted to fungal infections, especially the skin and the GI. Then mainly it is it is effective against Candida species, especially the oral candidiasis, etc. And it has got very high systemic toxicity. Please think that most of the antifungal drugs do have very high systemic toxicity because the fungal cell is having the similar structure to that of the host cell. But the nystatin is not absorbed from the skin. So topical oral administration is safe. Then the cutaneous irritation may develop on repeated topical application. So the drug, then yes. So the oral administration may cause the lot of GI discomfort, and parenteral administration is associated with hemolytic anemia. So this is having a lot of the side effects, preliminarily skin, mouth, intestinal or vaginal candidiasis. In dogs and cats and birds, of course, in case of human being, it is used. So this is lesions of thrush, that's the oral candidiasis, and vaginitis usually respond very well to this particular nystatin. And it is not effective against the dermatophytes. So it should not be prescribed. Then the topical preparations include the ointments, creams, and powders, topical preparation. And tablets and suspensions are available for the oral administration, and the combination with antibacterials and steroids are also available, but it enhances the efficacy to take the Candida super infections. Usually it happens. So it should not be used in patients that are hypersensitive to it, should not be used. And parenteral administration is very toxic and should not be used. So whereas the amphotericin B we are using in mucormycosis and especially the black fungus infections, with toxicity is there, but there is no alternative. Then this is once again to make you to remember, this is a fungal cell which is containing all the structures of similar to that of the host cell or the mammalian cell. So it is containing the cell membrane and also the cell wall with the outer proteins, and it's containing the outer coat, and this is the beta glucan. Then there are chitin molecules are present here. Then this is a cell membrane. So the structure of nystatin is like this, very exactly similar to that of the amphotericin B. Whereas this dose of this thing, so the thing to remember here, it is expressed in units, especially the here you can right side you can see that there is a nystatin tablets, that's 10,000 or 1 lakh tablets are there. So the dose is 50,000 to 1,50,000 units. So this need to be remembered. So cats, it is 1 lakh units totally. Whereas it is also used in case of the crop mycosis and mycotic diarrhea in case of the birds. That's 50 to 100 grams per ton of the feed for 7 to 10 days need to be administered. Then the natamycin, or it's also known as pimaricin. So it's a polyene antifungal antibacterial antibiotic. So obtained from the Streptomyces niloensis. streptomyces nail disease. So this is used for topical treatment and also the disinfection of the ringworm contaminated environment. And it is less irritating when compared to the amphotericin B and used to treat fungal keratitis or dermatitis, which is induced by the fungus. So structure of the natamycin is like this. Of course, the 5% suspension or 1% ointment. This is the suspension, ophthalmic solution, and 1% ointment is available for the eye infections. Hope you might have heard that in case of the corona recovered patient, especially with comorbidity, who have been receiving the corticosteroids, they always get the infection of the mucormycosis. So there also there will be eye infections, etc. will be there, and also the nasal septum. And the dose of this drug is which is available as eye drop and 5% ophthalmic solution. So this is installed into the eye every 1 to 2 hours. And haumycin or the primamycin is also another drug obtained from, that's the Streptomyces primprina. So Streptomyces primprina is the base or the source of this haumycin. And this is very similar to that of the nystatin and used mainly topically for the oral thrush. Topically for oral thrush. Then it is having the oral. It is especially the cutaneous candidiasis and trichomonas vaginitis. So the vaginitis is which is caused by the trichomoniasis is effectively treated with haumycin. And this is the structure of the haumycin. So almost all the structures of the different antifungal drugs will look similar, and the mechanism of action is also similar. Then other polyene antibiotics like candicidin and also the hachimycin are the polyene antifungal antibiotics used occasionally for the local fungal infections. So just to give the difference to remember how the bacterial cell wall looks like. So the fungal cell wall is like this, fungal cell. So it is having a bud which is containing the different intracellular materials. So here you can see that this is the cell wall of the bacteria. Of course, the outer coat is the cell wall, especially in the particular fungal cell, whereas it is not having the pilus. Here, the hair-like structures are pilus, but this is not having the pilus. Of course, it has got the cell membrane. Both of these have got cell membrane, whereas the ribosomes are present throughout the cytoplasmic fluid. So the cytoplasm, both of them are having, whereas the bacteria do have the pilus and also the capsule, then the nuclei and the mesosomes like these polysomes and the plasmid. These are all the structure, whereas the fungal cell do have a septum, then it is more developed than that of the bacterial cell. It is having the Golgi, this is Golgi complex or Golgi apparatus. Then peroxisomes are there. Of course, the endoplasmic reticulum is also present. If this is the ER, the protein synthesis source. So it is also having nucleus, very well developed nucleus. Then the nucleolus is also present. Then the lysosome is also present. Then the cytoskeleton will be there. The very well developed mitochondria, the energy source is present. And the vacuole is also there, whereas the bud scar is here. So this is very, very similar to that of the mammalian cells. That's why the drugs which are used against to this fungal cell attack are many times they are going to have the toxicity to the host cells also. Then just to compare with that of the plant cell, the difference between the plant cell and fungal cell, just for your reference, that's all. the plant is having the chloroplast and amyloplast extra to that of the thing, and all other things are present in the fungal cell. So it's containing cell wall, the Golgi apparatus, the cell membrane, peroxisomes, ribosomes, around endoplasmic reticulum, the nucleus, cytoplasm, mitochondria, vacuoles, then cytoskeleton. All these structures are very similar to that of the plant cell. So this fungal cell is in between the plant and the mammalian cell. So in plants also, many varieties of the fungal infections are seen. The heterocyclic benzofurans or benzofurans are the systemic antifungal antibiotics obtained from the Penicillium griseofulvin. So that is the microorganism which secretes the griseofulvin, and it is isolated in 1939, so many years back. So this antifungal activity demonstrated only around the 1960s. So this exists as the odorless, nearly colorless, bitter tasting, white to creamy white powder. And of course, it is slightly soluble in water, and it is soluble in the organic solvents like the methanol, ethanol, etc. And the particle size varies from 1 micrometer or ultra micronized up to 10 micrometer in diameter. So structure of the griseofulvin. Then the mechanism, it is similar to the general mechanism of antifungal drug, but it's a fungistatic drug which enters into the susceptible fungi through an energy-dependent transport system. So this acts by interfering with polymerization of the microtubular protein with microtubules. That means this is effective against the fungi by inhibiting the microtubular protein synthesis, and interaction with microtubules interfere with the spindle formation. So you know what the spindle formation, etc. during the cell division, thereby arrest the metaphase of the cell division. So the cells, they divide, and the metaphase of the cell division is blocked. And this leads to production of multinucleate fungal cells. So the fungal cells will have the varieties of the nucleus, and they become slowly not functional. Then the impairment of the microtubule function may also interfere with the transport of essential material to the cytoplasm to the periphery, which accounts for the inhibition of the hyphal cell wall synthesis. So it interferes with the transport of essential material through the cytoplasm to the periphery. Then the griseofulvin also probably binds to the RNA and inhibits the nucleic acid synthesis. So coming to the antimicrobial spectrum, it is a narrow spectrum antifungal drug active only the dermatophytes like the Microsporum, Trichophyton, then Epididio phytons, and unique among the antifungal agents that on oral administration accumulates into the keratin and produces action against the superficial fungi, especially the oral mycosis. But this is ineffective against the deep mycosis, especially the Candida species and some of the bacteria. So this is a specific fungistatic agent, older and dormant fungi, but may be fungicidal to the actively metabolizing and growing young ones, especially in the fungi. Then the fungal resistance, it's a very common thing. It's very fast also. So griseofulvin, of course, the fungal resistance is rarely a practical problem because it is not having such antifungal resistance. However, dermatophytes can be made resistant mainly due to the decreased drug uptake. That is the mechanism. And kinetics, the amphotericin B and the other drugs, natamycin, etc., they are not absorbed orally. And we'll see what about this particular drug is concerned. So after oral administration, it is variably and erratically absorbed from the GIT, mainly due to its poor solubility. Then absorption is, in general, depends upon the particle size and also the different preparations, what we have seen is concerned. Then, so the small size, ultra micro ionized particle and a fatty diet facilitate the absorption. Then oral absorption of micro-sized form of the drug varies from 25 to the 70%, while the ultra micro size is it approaches 100%. So that's the dosage forms are designed in such a way that it should be absorbed properly. And after absorption, it is concentrated in skin, hair, nails, fat, especially, and also the skeletal muscles and liver. These are all the places because it accumulates in the skin and hair, and so it is effective against the dermatophytosis. So it is high affinity for keratin precursor cells, and griseofulvin remains bound to them and persists in the new keratin tissue which is formed. So the new growth of the hair and nail is the first to become free of the fungal infections. That's why the nail infections, it's very difficult to treat, but this griseofulvin, it is prescribed very commonly. And it does not destroy fungi that infect the outer layer of the skin or older hair nails. The new hair, nail, or the skin growth accompanied by the shedding of the old growth is necessary for complete eradication of the fungi. That means, so the already which is infected, suppose there is a nail infection from the fungi, then there will be shedding of that particular nail and also sometimes the hair, skin, etc. Then it requires the complete eradication. So thus the drug action is slowly requiring, the time is 4 to 6 weeks of therapy for skin infections and up to 1 year for nail infections. See, such a long time it need to be given because otherwise it's very difficult to eradicate the fungal infection. And secreted in perspiration, so sweat and transepidermal fluid loss may be important role in transfer of the drug in the stratum corneum. So it is secreted in perspiration and also the sweat and transdermal fluids. So loss of this may play an important role in transfer of the drug in the stratum corneum. And it is metabolized by the liver via oxidative demethylation and also the conjugation to inactive metabolites. So there are no active metabolites, and about 1/2 of the drug is excreted as metabolized in the urine. Then the remainder is excreted unchanged in the feces. So it is excreted through the urine and feces also. So side effects, as usual, infrequent and generally not so serious. Yes, it is there, but not so serious. Whereas the GI disturbances very commonly occurring, nausea, vomiting, diarrhea, and the hypertoxicity, sometimes the CNS signs, and depression, ataxia, and hemolytic, these alterations were also seen. Especially there is a decrease in the neutrophil size and also the leukopenia. The cats, particularly the kittens, are more susceptible to the adverse effects of this particular drug because the inadequate glucuronidation and inactivation of the griseofulvin. So these are the two mechanisms. So inadequate glucuronidation and the inactivation of the griseofulvin. So they are more susceptible. Then the adverse effects appear both dose and time dependent. And at very high doses, it produces the teratogenic and carcinogenic effects in the animal, especially in case of the cats. One should not administer. If given to cats during the first trimester of the pregnancy, griseofulvin may cause the cleft palate and skeletal and CN abnormalities, especially in the kittens. So it should not be administered. So this is a potent microsomal enzyme inducer. Means if you use it continuously, the enzymes gets activated and the metabolism of the other drug increases very fast. So contraindication, this is contraindicated in patients that are, it is hypersensitivity to or the pre-existing hepatocellular insufficiency. So it's also known teratogen already and should not be given during the first 2 trimesters of the pregnancy. Suppose in case of the pregnant animal or woman, it should not be given first 2 months of the pregnancy. And use in cats should be closely monitored due to high incidence of the adverse drug reactions, especially the cats. Drug interactions. So the potent microsomal enzyme inducer promotes biotransformation of many concurrently administered drugs like the anticoagulants, example, warfarin and the congeners. Then other drugs like the phenobarbital and the other barbiturates reduce the antifungal activity of the griseofulvin. So they are going to induce the hepatic microsomal enzyme biotransformation. And this is combined with griseofulvin and ketoconazole leads to hepatotoxicity if it is administered orally. So clinical use, this is very commonly used in the dermatophytic fungal infections of the skin, hair, and claws of the dog and cats and cows. Of course, the horses. So this is available for oral use as a either micro-ionized or micro-size and ultra micro-size tablets, and it should be administered in the fatty meal. Particularly a micro-size preparation is available and that is used. And treatment should be continued up to at least 1 week after disappearance of the clinical signs, or else the reattack of the fungal infection occurs and it is difficult to treat. So here it's available as the griseofulvin tablets, then it is 500 milligram tablet. So the dose is 20 to 50 milligram orally once daily in 2 to 3 divided doses with fatty meal or the corn oil. Whereas the ultra micro-ionized preparation, it requires little less dose, that's the 10 to 25 milligram once daily, minimum a week of time, or else the relapse may occur. Then cattle, it's also used as 5 to 10 milligram orally once daily, 3 to 6 weeks or longer. Whereas the swine, it is the dose is 20 milligram per kg for the 6 weeks it is administered. So the griseofulvin powder, especially this is available as oral use in case of horse, it contains 2.5 gram of the active principle. So here we'll have a very short look of the griseofulvin mechanism. Of course, time is running short. So these are the microorganisms to which it is affected. So especially the Tinea capitis and the Tinea pedis, especially they are affected. Yes, entire body is affected with Tinea. So this is the structure of the griseofulvin. So as already informed, this drug is effective against the microtubule formation. That's the metaphase. So this has got the poor absorption and highly, it is having very high long duration of the treatment is very much required. So here see, this is 6 months, nobody can take it. So this is where having very poor absorption, then you can see the griseofulvine microannuals form. Pregnancy should not be used. Important is pregnancy should not be used, and cats also should not be used. So this is also having the hepatotoxicity and other commonly used side effects. So it is available as tablet, then no injections. So the nail infection, it's very difficult to treat, including the human beings, especially the ladies, especially while they are washing the utensils, etc. They may get the infection of the nail if they are not hygienic enough. So this requires long-term treatment, and always it is toxic. So tomorrow we will deal about the anti-metabolites, especially the flucytosine, etc. Thank you. Then, yeah, I will take the attendance. Okay, please hold on. Okay, okay. 44. Please attend the quiz. Today I am going to give the quiz. Then please attend. Attendance. Today's date is 21. So, okay, now we can log out. Thank you. You can log out.